Welcome back at 7:15. It is officially the holiday season, a time for family, festivities, celebrations, and indulgence. But beneath the festivities lies a health concern, a significant increase in heart attacks. Dr. Leonard Glade from Touro he's a Touro Interventional Cardiologist. He is here with us this morning to discuss. Dr. Glade, good morning. Thanks so much for being here.
Thanks for having me.
So let's talk about why this December, top of December, beginning of January time of year is such a honestly dangerous time for people who have heart health issues.
So I think with a lot of stuff, the weather changes as it gets colder. We're starting to see more flu, a lot of different viruses that are out there. A lot of that triggers a lot of cardiovascular disease, heart attacks, heart failure, those type of things.
And seeing a lot more stress because the holidays, as beautiful as they are, can be stressful for a lot of people.
Right,
correct?
can't ignore stress as a big factor for cardiovascular health.
Let's talk about food intake. And also kind of with that cholesterol. Obviously Thanksgiving's a holiday that's heavily centered around food, and honestly Christmas is too around this part of the country. But what should people be considering when they're sitting down for these meals and they're obviously eating food that's more rich than what they normally are eating, and they're having maybe more cocktails than normal, more sweets than normal? So
I like to say moderation is key. Portion control. You also need to watch the types of food you're eating. So lots of sweets, fatty foods, I would try to avoid those as much as you can, although sometimes in the holidays it's hard, but really moderation is going to be where the main bang for your buck is. And
I know people tend to, they go in with a plan of moderation, and things often get out of control. But what are some things that you should look for, signs, symptoms that you look for in yourself and even your family and friends as you're gathering that may indicate something's up, we need to get some medical help?
Right. Chest pain, the big one for us that we look for is chest pain, but you also can get shortness of breath. Typically, if you're having signs of like fluid retention, you're going to see some swelling in your legs, difficult to lay down. But the big one from a heart attack standpoint, chest pain, some people can get arm pain, back pain, and heartburn as well.
I know in women some other signs and symptoms show up too. What are some things women should be on the lookout for?
Right, so some of the other symptoms besides chest pain, kind of like what I was saying with heartburn, that's a big one. A lot of people can have this exertional heartburn symptom that they're not realizing is coming from their heart, and also back pain and arm pain.
Okay, and let's talk about looking ahead to the new year. Obviously, people are going to try their very best, their level best, to take care of themselves during the holidays. But the new year, they start off with a resolution. What's maybe one, an easy, let's go easy, heart healthy habit that people can start and carry through 2026?
I tell my patients to just walk. If they can just do a simple starting slow. If they can do a 5-minute lap around their house, if they can just do a 10 minutes around the block, just something where they're starting, where they're getting outside and they're starting to do some cardiovascular exercise.
And while people are eating a lot tomorrow and through the holidays, maybe a good idea after
you can start then. Right, you can start then.
Just kind of do a little walk to walk off the turkey. Well, Doctor, we appreciate those tips and reminders as we are now officially crazy enough in the holiday season.